Kyla Joyce Eugenio from BSN 2-5, I will be performing postpartum maternal physical assessment. The purpose is to fully assess a postpartum mother, thereby preventing complications after delivery. First thing we're gonna do is make sure to wash your hands, provide privacy to the client, then identify the correct patient, introduce yourself, and say the purpose of the intervention. Eugenio, I will be your nurse today. How are you feeling?
I'm good.
I'm gonna do a postpartum assessment. I'm gonna check on you. Breast assessment. Position the client in a supine or sitting position. Open the gown. Expose the breast to be examined. Inspect for the following: consistency, nipple type and integrity, swelling, redness, engorgement, and tenderness. Then last, tie the gown. Expose the client's abdomen, covering the upper part and lower extremities. Assess for the tone, height, and the location of the fundus. Ask client whether she moves her bowel or not, or flatus is positive or not. When was the last time you go to the bathroom? Auscultate for bowel sounds. Assess for abdominal distension. Ask client for the voiding pattern, presence of pain or burning sensation during urination. Next, palpate for bladder distension. Track fluid balance, intake, and output. For lochia assessment, assess for the amount of lochia, note time of the last perineal pad change. Note for the amount of lochia on the perineal pad, scant, small, moderate, and large. Assess for the number of days the woman has delivered her baby. This type of lochia or vaginal bleeding is based on this. Lochia rubra, 1 to 3 days, blood is in red in color. Lochia serosa, 4 to 10 days, vaginal discharges is brownish pink in color. Lochia alba, 11 to 21 days, vaginal discharges is yellow to white in color. Next, document number and size of blood clots. Turn patient to assess the blood loss under Botox. Last, remove the medical gloves and do hand hygiene. For episiotomy assessment, first, wear sterile gloves. Place the patient in lateral position with her back facing you. Expose the client's buttocks. And then inspect for the following readout: redness, edema, ecchymosis, number of stitches, consistency of discharge, and approximate the edges of the stitches using your thumb or index finger, noting the presence of discharges from stitches and pain upon palpation. Next, dispose or arrange used materials properly, then do hand washing. Next, record all data in the client's chart. Last, refer any abnormal findings to the attending physician.